Thank you for joining us. I'm State Representative Kate Farrar, representing the 20th District in West Hartford and Newington. And we are here today because our Connecticut residents face very real threats to accessible and affordable health care. Because this summer, H.R. 1, passed by Congress and signed by President Trump, created an instance of devastating increases for our residents who are on the Access Health Exchange. And now, with the government shutdown and without congressional action, these increases are becoming ever more real. Just this week, 150,000 folks on Access Health began receiving letters of the range of these increases, everywhere from additional $1,000 a year to over $40,000 more a year to stay on Access Health and receive health insurance. It's why we're gathered here today, because without congressional action, we need to be prepared to act as a state. We need to be prepared to act in special session to make sure that we have a significant enough emergency fund to support our residents to get affordable and accessible care. So today you're going to hear from leaders on health insurance in our legislature, as well as advocacy partners, and two incredible stories from folks who have received just this week these types of notices. So without further ado, I'd love to welcome Senator Jorge Cabrera, who is the Senate Chair of our Insurance Real Estate Committee, to share his perspective on why this is such a critical issue. Senator Cabrera.
Thank you.
Thank you.
Thank you. Thank you. Good afternoon, everyone. We're here. We don't want to be here, but we are here at this particular juncture because literally thousands of people all across Connecticut are staring into a new reality. Go without health insurance or pay out the nose for more. And we're here because the Trump administration has decided to balance their massive tax cuts for billionaires and millionaires on the backs of middle and working class people. And we have a choice to make here in Connecticut as we get ready for a special session. Whose side are we going to be on? Are we going to be on the side of Connecticut families who are struggling to make the bills, to pay their bills, to put food on the table, and are staring down the barrel of ever-increasing healthcare costs? From my vantage point, it's called a rainy day fund for a reason, because the storms are gathering and there's some trickling happening and people are going to get really hurt unless we act. So I'm calling on this legislature, on this governor and others to step up to the plate and to do the right thing. The truth is, we cannot control what happens in Washington, D.C. If that isn't clear now, I don't know when it will be. We have absolutely no ability to control what they're doing, but they are doing what they're doing. They're hurting Connecticut families. And we are in a strong financial position with a record rainy day fund, with lots of funds available to us to do the right thing. Is it a big number? Of course it is. But this is a big problem that requires a big solution, and it's time for Connecticut to step up and do the right thing for Connecticut families. That's why I'm here. You will hear from people who are directly impacted by this after I speak. But it is time for Connecticut to step up to the plate and do the right thing for Connecticut families. And I hope that we can find courage and the moral obligation I think we all feel to do the right thing and help our families. Thank you.
Next, I'd love to introduce Callie Moquette, who is with Health Equity Solutions, to share a little bit more in detail about what has been happening with the Access Health increases. So Callie, please.
Good afternoon, everyone. My name is Callie Moquette, and I'm here on behalf of Health Equity Solutions and our Executive Director, Aisha Clark. HES is a statewide, nonprofit, nonpartisan advocacy organization. Our vision is for every Connecticut resident to attain optimal health, regardless of their race, ethnicity, or socioeconomic status. I'm also here today on behalf of the Medicaid Defense Campaign. It is a statewide effort being led by the Connecticut Citizen Action Group, or CCAG, to protect health coverage for thousands of Connecticut residents. Our campaign brings together community partners, advocates, and community members united for one single goal: ensuring that no one in our state loses health coverage due to inaction in Washington, D.C., or poor planning here in Connecticut. CCAG launched the Medicaid Defense Campaign because the stakes couldn't be higher and division wasn't an option. Right now, while Congress and federal agencies are debating whether to extend federal subsidies that have been in place since the pandemic, millions of Americans are worried sick about their ability to afford basic care for themselves and their families. When those premium tax credits expire on December 31st, tens of thousands of Connecticut residents will lose access to affordable health coverage, especially low-wage workers, people of color, immigrants, and older adults who already face barriers to care. This week, as you heard Representative Farrar mention, many Connecticut residents received a letter from Access Health Connecticut, our state's health insurance marketplace. These letters are not bills. They're part of an annual open enrollment process which takes place every fall from November 1st through January 15th. This letter will tell you what health plan you're currently enrolled in, how much your premium is likely to be next year, assuming Congress does nothing to enhance these subsidies, to extend the enhanced subsidies, how much financial help you'll receive, and what you need to do to renew your coverage in 2026. What has been a routine renewal process since the pandemic will be significantly different this year. This year's letter comes with significant price increases for many people who will be unable to afford to maintain their coverage on the marketplace. And to make this real, I want to give you some concrete examples provided by Access Health Connecticut. A family of 4 living in Bristol with an income of $72,100 a year, who currently pays $179, will now have to pay $438 a month instead. A 34-year-old living in Clinton, Connecticut, with an income of $72,000 a year, who now pays $497 a month, will have to pay $818 a month. A couple living in their early 60s, living in Somers, Connecticut, with an income of $86,000 a year, who now pays $343 a month, is now going to be expected to pay $3,111 a month. That's an increase of $33,216 per year. Each one of these examples represents a person or a family whose healthcare stability depends on the decisions made during special session and the next few months. If you're enrolled in Access Health Connecticut and you receive one of these letters, we encourage you to read these letters carefully. Check that your address and income and family size are up to date. Log in or call to renew your coverage. Speak to Access Health Connecticut navigators. They have trained staff who are there who can walk you through the process free of charge. This matters. Time is running out. Special session is when Connecticut has an obligation to its residents to act. Connecticut can see a wave of disenrollments. What this means, we know: more uninsured residents, higher uncompensated care costs, families forced to make impossible choices between paying rent, buying groceries, or keeping their health care coverage. That's why we're calling on you, Connecticut leaders. Invest in making healthcare more affordable and ensuring that it's adequate by training staff, partnering with community-based providers. Healthcare is a human right, not a privilege. We've been here talking about this before. When people lose coverage, they fall through the cracks, they delay care. We cannot stand by while families are forced to choose between rent and life-saving medication. When we strip away care from those who need it most, we all suffer, economically, socially, and in the health of our communities. These letters are more than paperwork. They're a warning sign, but they're also an opportunity. Let's get ahead of the problem, protect our people, and keep Connecticut healthy and covered. Connecticut has the resources, the tools, and the talent to do this right. What we need is the political will to act quickly and in the best interest of Connecticut's low to moderate income families. Thank you.
Thank you, Callie. I'd next like to introduce one of our residents who has received notification of these changes, and that is Alicia Chermet. She actually leads the Rivers Alliance of Connecticut, and she is from the great town of Newington. Welcome, Alicia.
Thank you. Our current health insurance through Access Health CT. Covers myself, my husband, and my 19-year-old daughter. Just for a little bit of background, my husband and I both have long, stable careers. I work for a small environmental nonprofit, and my husband is a biostatistician. For years, he had excellent insurance through his employer until the company went bankrupt. Job hunting after 55 is no joke. After hundreds of interviews, and that's not even an exaggeration, he ended up having to piece together consulting contracts, which means that we now rely on marketplace insurance through Access Health CT. And because my husband has a chronic illness, low or high deductible plans are not an option, and having no insurance is certainly not an option. In 2025, our premiums went up 17%. We currently pay about $1,500 a month with the premium tax credit. And for comparison, our premium and interest in our mortgage is $1,400 a month. So we are paying more for our health insurance premium every month than we do to keep a roof over our head. Without the premium tax credit, our payment would be $2,800,000 a month. For comparison, our mortgage payment with the principal and interest, escrow for taxes, and homeowners insurance is $2,500 a month. If the premiums increase again this year as much as they did last year, we're going to be paying nearly $3,000 a month for health insurance. And that's before meeting our deductible, while medical bills pile up each year. On paper, our family looks upper middle class. But the truth is, the cost of health coverage is sinking us. We could be making significant contributions to the economy, buying a car, renovating our home, or finally putting in that new modest patio I've been wanting for 10 years. But discretionary spending is nearly gone because of the cost of healthcare. If we lose the premium tax credit, our premiums jump another $1,500 a month, our discretionary spending will have to come to a complete halt. I know we're not alone. There are thousands of families like ours working hard, doing everything right, and who are already crippled by the cost of health insurance coverage and healthcare itself. We're all going to face the impossible choices when these premium tax credits disappear and our monthly premiums go up. Thank you.
Thank you, Alicia, for illuminating those real life consequences and why our state needs to prepare for action. Next, we have another guest who is joining us to share a little bit about her story, Leslie Silverman, who is a marketing consultant from West Hartford. Leslie.
I can't tell you how much I can relate to that story. Sorry.
We got you.
The last time I was here in this building was 2009. It was for MS Action Day. I was newly diagnosed with MS. I was newly divorced from a physician who was the one through which I got my health care. So I was thrilled in 2010 when Obamacare came around and I was able to get my own insurance. I think it cost me about $700 a month. In 2017, I got my dream job. I was the director of marketing and outreach for Connecticut Public Media down the street here. And my rates for healthcare dropped 50%. And I also got disability insurance. That was like awesome. It was just so comforting to know that that was there if I needed it, and thank God I didn't. But in 2022, We had a new CEO and he laid off our entire marketing department. And I had a similar number of interviews and decided I had to just work for myself again. I'm a consultant now and I happen to really love it. But I was on Cobra from Connecticut Public for a long time. Everybody knows Cobra is expensive, right? My plan on Access CT is 20% more.
I'll be right up.
Without this whole problem than what I was paying for Cobra. My payments are about 30% less than my mortgage, thank goodness. But I'm looking at them going up a lot. Probably they will be at least meeting my mortgage. My meds without insurance would be $10,000 a month. And with insurance, I can be standing here in front of you, upright, working, productive, consulting, helping small businesses to become bigger. And I really don't see that not having coverage is an option. One of my best friends from college lives in Illinois, and she's a freelance lawyer. There's a program you can get in Illinois, which you can't get in Connecticut, unfortunately. She pays $700 a month for her insurance. That's what I paid in 2010. And there's no way that I can get that kind of coverage. So right now, I'm grateful for Access CT because without it, I really don't know where I would be. But I think about everything from putting on a sign saying, we'll work for insurance, to moving to Massachusetts, to moving back to Chicago, which is where my kids were born, because I don't know how to sustain this. I really don't. I got the letter the other day, and I had just gotten my new insurance, and I got this like a week later. We have to do something. I feel like I am the lucky one. I am healthy-ish, but I need this insurance, and I know, and I have means to work, but I know a lot of other people are making a lot less than I can and are even more severely impacted, and so I'm here because I want you to think about them as well. Thanks.
Thank you, Leslie, for sharing that. And next up, just to share a little bit more about these connections to economic security that are so prevalent in the two stories you heard, is our House Chair of the Human Services Committee, Representative Gilchrest.
Good afternoon. Thank you both for sharing your experience. Our focus should be on ensuring people have access to health care, full stop. But with the Trump administration and Republicans in Congress insistent on cutting these essential subsidies, Connecticut residents aren't going to be able to afford their health insurance, and they're not going to be able to access that care that they need. And you've heard a lot about Access Health, but the bigger picture is that all of this is connected. And so when it comes to health insurance in the state of Connecticut, as you're hearing, there's some folks who can't take the risk of not having health insurance. They have a disease or a chronic illness where they have to have life-saving medication. And so they're going to stay on. But that means folks who are relatively healthy are going to take that gamble and drop their health insurance. And what that results in is then everybody else paying for that cost because health insurance will rise in other places. The other way it's going to impact the entirety of the system is with uncompensated care. Because at the end of the day, if someone breaks their arm, they're going to have to show up to a hospital. And if they don't have health insurance, they're going to be covered And that again comes out of the entirety of the system. We're also experiencing this at a time when HR 1 has had a tremendous impact on Medicaid and SNAP. So people are about to experience not being able to access food in the state of Connecticut and having their Medicaid either eliminated or severely reduced. And so this is a time for Connecticut to step up. It's been a time. This shouldn't be a conversation of whether or not we create an emergency fund in the state of Connecticut. It should be about how much are we spending right now. And we should have already been having the conversations about what's the list of priorities and what needs to be spent and when, because people are already being impacted. As you heard, there is a rainy day fund in the state of Connecticut. I don't know how many more conversations we need to have about the fact that it's pouring. Because it is. But even so, after our legislative session ended, we had high revenue come into the state. And so there is a pool of money that could be put into an emergency fund that would build interest so that we could be prepared for the cuts that are already coming from the federal government and that we know are going to continue to come. And so it's not just my hope, I'm demanding with my colleagues that when we go into special session, we have a plan in place to fill these holes so that people in the state of Connecticut have the health care they need. And so thank you for this opportunity, and I look forward to all of us working together to push for that.
Thank you, Rep. Gilchrest. I just want to acknowledge our many other colleagues here today, including Rep. Gucker, Rep. Elliott, Rep. D'Amico, Rep. Turco, Rep. Shake. On this side, we have Rep. Gaiesi. Wonderful, wonderful. And I just want to acknowledge so many other coalition partners here fighting for health insurance to be affordable and accessible in our state. As you heard, the moment is real, and that's why we felt it was so critical to join together today to make sure that residents know that we hear you. We hear the real strong concerns, stark concerns about your increasing health insurance costs. And we are prepared and want to act swiftly in special session to make sure there is a significant enough emergency fund to address these needs. So thank you all for joining us today. Really, really appreciate it. Thank you.